Good morning and good afternoon. Thank you for joining us for today's OJJDP Family Drug Court Grantee Welcome Webinar. My name is Phil Brighton-Busher. I am the Program Director for the National Family Drug Court Technical Assistance and Training Program. It's my pleasure to welcome all of you and congratulate you on your successful grant applications. Today's webinar, we are going to try to make it interactive as possible, and so if you haven't already done so, please enter your audio pin, which you can access via your dashboard, which is on the right side of your screen. You just need to open up your audio spot there. If it shows a flash, you just click on that. You'll have a drop down, and then you'll see your audio pin right there. You hit pound, whatever your number is, and then pound again. That'll allow us to see that you're see you here on our dashboard, and we can unmute your line so that we can hear from you when we do introductions in just a few minutes. As we go along, if you have questions, you can also type your questions into the question box, which is also in your dashboard, and submit those to us, and we will respond to you either during the webinar or following the webinar. So again, welcome to today's webinar, and we would like to make this as interactive and useful to you as possible. We just wanted to start out acknowledging some of the past grantees. I think now we're up to about 42 grantees the last 4 years. These are a listing of some of the 2009 grantees. We then had another 8 grantees in 2010. Moving into 2011, there were 10. 2012, last year, there were 4 new grants awarded. And then this year, here's your cohort. And you'll see there that there are 7 new grantees that have been awarded. So again, congratulations, and if you haven't seen this list already, now you kind of know who's in your cohort. We do show you this list, and these materials are provided to you because we do think there's a lot of value in learning from your peers across the country, and some of you are working on very similar types of projects or enhancements or even implementations, and so if possible, we'd always like to try and connect grantees together to learn from their shared experiences. This map just kind of displays those grantees across the country visually for you, so you can see them kind of how they're geographically dispersed across the country. Let's go ahead and get started with introductions. I see that I think all of you now have gone ahead and entered your audio in. So what I'm going to do now is I'm going to unmute your lines from here. That'll basically make all of you, bring all of you online. And so if you plan not to talk, then I would ask that you mute your line on your end, because I'm going to go ahead and unmute you from our end. And so if there's any background noise in your office, music playing, dogs barking, any of those types of things, we're going to try to keep those from the audio recording. But let's go ahead and bring you online, and we'll go ahead and do introductions. And I think the easiest way to do those would be to go through this list. And I'll just go left to right, if that's okay. If we can, start with Jackson County Circuit Court, Ho-Chunk Nation, Healing to Wellness Courts. Would someone from that court like to introduce themselves?
All right, this is Jackson County, Wisconsin. My name is Judy Ludio. I am the Family Treatment Court Coordinator. And at the table with me today, I have Judge Thomas Lister and Kathy Powell, the Register and Probate and Office Manager of Judge Lister's office.
Great. Thank you. Welcome. Can we hear from Summit County Family Drug Court?
Yeah, I'm Laura Robinson. I'm the Judicial Attorney in Summit County Juvenile Court. I represent what we're calling the Family Reunification through Recovery Court.
Great. Welcome.
And I don't know, can you hear me?
Yes.
Oh, okay, I'm sorry. My name is Woody Terrell. I'm also with the Summit County Juvenile Court, and I'm the grants administrator, so I was involved in putting this all together to get this approved.
Wonderful. Welcome. Thanks for joining us. How about anyone from the Idaho Supreme Court?
This is Debbie Elsacker-Burke. I am the Court Improvement Project Manager for Idaho. I'm a co-grant manager.
Great. Welcome.
Thank you.
And just moving down from the state of Montana, the 13th Judicial District, Yellowstone County.
Yeah, my name is Cindy Icopini. I'm the Family Drug Court Coordinator here in Montana.
Hi, Cindy. Good to hear from you again.
Thank you.
And from District of Columbia, Child and Family Services Agency.
Yes, hello, this is Jasmine Hayes. I am the grant coordinator for the Child and Family Services Agency, and our project is a collaboration between our family court, the Child and Family Services Agency, and our Addiction Prevention and Recovery Administration.
Great, welcome and congratulations. Also, let's move over to Oklahoma.
Yes, hi, this is Jennifer Dell, and I am the project director for our grant, the enhancement grant that's in our Oklahoma County Family Drug Court.
Thanks, Jennifer. Good to hear from you again. Rhode Island.
Hi, this is Donna Caldwell, and Ann Webb is with me. We're the members of the evaluation team for the Rhode Island Family Court.
Excellent. Well, welcome to you all. And again, we congratulate you on your grant. I would like to, I'm sorry, I didn't click on the screen, but you did what we needed you to do, so that's okay. I would like to now turn it over to and introduce to you our OJJDP program staff. First of all, I'd like to introduce Mark Morgan, who's the program manager with the Juvenile Justice System Improvement Division, Office of Juvenile Justice and Delinquency Prevention, Office of Justice Programs. He is assigned to manage a portfolio of grants and earmarks that address juvenile, at-risk youth issues and their custodial families and guardian issues. Mark Morgan has an excess of 25 years of experience, and I think all of you will find Mark to be very responsive. We've enjoyed working with him over the years. So welcome, Mark. And I'll go ahead and also introduce Angela Parker, who's on the line with us, who you'll be hearing from also. Angela Parker is a juvenile justice program specialist who's been with OJJDP for 24 years as a juvenile justice program specialist with the U.S. Department of Justice, Office of Juvenile Justice and Delinquency Prevention, and currently responsible for overseeing the implementation and management of programs which have a direct impact on youth throughout the country, such as the Juvenile Mentoring Program, Truancy Reduction Program, Tribal Youth Program, Drug Courts Program, and many other programs. So welcome to Mark and Angela.
Okay, you want me to go first? You want to go first, Angela?
You can go ahead and go.
Okay. All right, well, good afternoon or good morning. And again, want to welcome you to the welcome webinar for the Family Drug Course FY 2013 cohort. Just want to thank you for being here with us. Want to congratulate you on receiving your award and just let you know these are exciting times for family drug courts and the drug court field as a whole. OJJDP with our administrator, Bob, he is taking the lead in beginning the process to build off of what we learned to develop standards and procedures for drug courts. The field is evolving and growing as we speak based on lessons learned. The Center for Children and Family Futures, or CCFF, has been helping us with this process along with the government agencies. And again, it's an exciting time. The Center for Children and Family Futures is the OJJDP TTA provider, training and technical assistance provider for the family drug courts, and they will be taking the lead on this webinar. Angela and myself, we would do a brief overview of the mandatory programmatic, financial, and performance measure, or DCTAT, reporting. Again, welcome to the webinar and to the Family Drug Court family. Angela.
And now that Mr. Morgan has basically said everything that I had planned to say, again, my name is Angela Parker. I am one of the Juvenile Justice Program Specialists in JJSI and OJJDP. And again, I would like to piggyback on what he said, or ditto everything he said, and welcome. Thank you guys for applying, and congratulations for accepting and receiving. And one thing I did want to point out while I have all of you on the line is that we are aware that some of the budgets may have not still been cleared. We and the OCFO are still constantly working with trying to get those resolved. And now that everyone is back from holiday, we should have all of those done within the next week or two. So please be patient. And if you still have any issues or concerns with anything prior to, with that issue, I wanted to bring this up now so that, I know that's in the back of a lot of you guys' minds, since these awards were granted October the 1st. But please let us know if there's anything else that we need to do, and we will be reaching out to you also constantly to make sure that we can proceed with getting these things resolved. Again, thank you so much.
Yeah, and just want to concur with Angela regarding the budget issue. We are working feverishly just trying to get this done, and everybody's back. So 2 weeks, and hopefully before 2 weeks, all of the budget should be cleared and approved.
Yeah, we are working on those as we speak. That's it.
Okay, Phil, are you still there?
Yes, I'm here. Did you want to go through any of these slides?
Okay, yeah, I can start that also. And let me just share one other thing. Angela and myself, we are part of the drug court team in our division. And normally, if one of us is not available, you usually can talk to the other one. And normally, I will back her up, and she will back me up. And she has experience, and she's probably familiar with my grantees as I am with her. So just want to share that with you. And then to begin, give me 1 second with the slides. Okay, and where I'm going to start is something called DCTAT, or Data Collection Technical Assistance Tool. And that is the method that you report your performance measures. And it is a separate system from the Grants Management System, or GMS. And what happens, normally you would report your data, and I know a lot of you are new and you may not have data. You still need to complete the reports, but then you just would put zeros in a different category until you get data. But you need to submit the report to the DCTAT system, and then once you do that, you want to make sure you make a copy, a PDF copy. The next report will be, we call it progress report, but it's called the Categorical Assistance Progress Report, or the CAPR. And what happens, and let me back up too, because reporting is the way that you could have difficulties. Let me share two things. If your reports, they give you like a 30-day grace period from the deadlines that we have on there, and if they're not submitted, yeah.
I'm sorry to interrupt. Your phone is kind of breaking up just a little bit.
Yeah, this phone. Okay, let me. Maybe is this better?
Yeah, that's better.
Okay, give me. Okay, give me 1 second.
And then also don't forget about the part that they have to upload the DCTAT report into the categorical progress report as well.
Yeah, okay, and I'm having multiple technical problems, but let me just go with the phone. You can hear me on the phone. But yes. Basically what I wanted to share is that you have to submit your reports in a timely fashion. If you have questions or if there's problems when you submit your first series of reports, reach out to Angela and myself. And what I wanted to say is that if you do not submit the report on time, the system will automatically freeze your funds if any of the reports that we're going to talk about are delayed. So after that 30-day grace period, they will put a hold on your funds, and it normally takes 5 to 10 business days for them to get it off. It normally will, once you submit the report, the OCFO staff will automatically do what they need to do to release your funds. But the categorical assistance progress reports, or progress reports, the first one, and you were funded in October, so you would, your first one would cover the period from October 1 to December the 31st, and it's due January the 30th. And And let me go with the slides, though. Let me go with the slides. On the slides, it shows that from January 1 to June 30th, that's a 6-month period, and what you want to do when you do your report is look at your goals, objectives, and outcomes, and you want to correlate in your report what you were able to accomplish, what you did not accomplish, what lessons learned, or any barriers. And that report, that first one, is due July 30th only if you had began on January the 1st. The second report covers the period from July 1 to December 31st. And when I messed that up, let me back up. The first one I just shared about is due July the 30th, from January 1 to June 30th of the year beginning on January the 1st. Is due July the 30th, as the slide states. The second report is the biannual report, covers the period from July 1st until December 31st, and that is due January the 30th. And hopefully, what will happen, this report, because you were not funded until the 1st of October 2013, there will be a report due January 30th, 2014, but it will only cover from the beginning of your program, which is October 1, until December the 31st, due January the 30th, and you would cover whatever has occurred during that reporting period.
And I want to chime in right quick. And if nothing, no service or anything has been done up until this point, then just report accordingly. But those reports still must be submitted on time in the system, or it will lock you out.
Okay. And the second one is out of federal financial reports, or the FFRs. And well, I don't know, fortunately or unfortunately, we use a lot of acronyms in public. As we talk to you, we would say the CAPR or the FFR, but the FFR is the Federal Financial Report, and it is due basically after the end, 30 days after the end of the quarter. Again, there is one that's due, well, and I'm going to start with the slide just hopefully to make it clear. The first one would be for the quarter from January 1 to March 31st. That's due April the 30th, and it will cover.
Mark.
Yeah.
Since I don't mean to stop you, but since their grant started October 1.
Yeah, I'm going to come back and cover that.
Oh, okay, okay. I was going to say that would be.
Yeah, I'm just following the slide, but and I'm going to come back and cover that. They do.
Okay, okay.
One is due. Yeah, thank you.
Okay.
Looking at the slide, the first one, and except for we still have this period from October 1 until December 31st, but on the year where you beginning at the beginning of the calendar year, it's January 1st to March 31st, due on April the 30th, and as you go down the slide, April 1st, June 30th, July the 30th, July 1st to September 30th is October the 30th, and then October 1 to December, which is due January the 30th. And on this year, because you were funded October 1, there will be a report due January 30th, 2014. But if you have not drawn any funds down or did not have any activities of financial activity, you need to still submit a report, but you would reflect zeros in the report. You do have to submit a report whether you drew funds down or not. Again, if you don't, GMS will freeze your funds automatically. Okay. And also on your report, there is a match due with this grant. You need to also document and reflect the match or your share, probably say your share on the report. But that also, you need to track that, and if OCFO or Inspector General come out, they will look for how you used your match, and they are very strict on that. You do use all of the match, and they will, select certain people to come out and audit them. The next slide talks about filing the SF425 or the FFR. That's the same thing. SF425 is the form name, but it's the same thing as the Federal Financial Report. And they have some instructions on it that basically tell you how to set up and to do that. And everything is submitted online. All of the reports are submitted online. On the next slide, it just outlines some resources. And one of the things I think I had mentioned to some of my grantees is that OCFO, they offer regional financial trainings. Normally they are a day and a half. And they are free. You just need to call a number and reserve a slot. You do have to pay for your travel costs and your lounging. You do have to pay for that, but if you talk to your program manager and there are some funds in there, you may use those, but usually we hope that you would try to get the one that's closest to your physical location. And Angela, correct me if I'm wrong, there may be an online financial training.
It is, and
okay.
That information, you should be able to find it. It's not included in this slide.
Well, basically, we just gave them the number. We gave them the financial guide. But basically, to find that out, I would just suggest that they call the 1-800.
Yeah, if they call the 1-800 number, they will be able to provide that information to you, and or if you are with our listserv, you join our listserv. All of that information is normally sent out when all of those trainings become available via Washington, D.C. and another area, or online webinar.
Yeah, and if you want to take it to get on our listserv, if you're not already on it, go into your browser and type in JUVJUST. Again, it's JUVJUST. And then when you click on it, it will show you the information how you can enroll into our listserv. And it's usually a good idea because most of the information that comes out from OJJDP comes via the listserv, funding opportunities and other information. So it is something you probably want to do. And, and basically what you would do is just put the email of the staff or the person that you want to receive this information. Okay. Also on that slide, and probably is sort of important as you learn how to navigate GMS for the ones who don't already know, is the help desk, GMS help desk line, and that's on the slide. It's 1-888-549-9901, and you choose option 3, and they should be able to assist you. Just notice there are some times when you may have to leave a message because there are some peak times, particularly times when people are submitting applications where they may not be able to answer you personally, but then just leave a message. And if you have a problem, then myself or Angela will call us, and we will follow up for you. And again, the last slide that I have, and Angela, unless you have something else, is our contact information. And basically, it's email, and my phone number. Mine is mark.morgan@usdoj.gov, phone number 202-353-9243, and Angela's is Angela Parker, is angela.parker@usdoj.gov, 202-353-9252. Normally, the best way to contact us is via email because we do telework usually 2 or 3 days per week, and we do monitor the phone. But if you need to contact us immediately, I would send an email. So, Angela, is there anything else?
No, I think you covered it.
Okay. So that will complete this part of JJ staff's presentation.
Great. Thanks, Mark. Thanks, Angela. Are there any questions from any of the grantees before we move on to the training and technical assistance portion? Okay, and if something comes up and you would like to submit a question, you can do so using the chat box, but let's go ahead and continue on. So again, welcome from us, the Center for Children and Family Futures. We are based in Southern California, and actually Lake Forest, California. Our mission is to improve the safety, permanency, well-being, and recovery outcomes for children, parents, and families affected by trauma, substance use, and mental health disorders. We've been working in operation now for nearly 20 years, and we mainly consult with government agencies and service providers to work around kind of the niche around substance abuse treatment, child welfare systems, and the courts. And just to give you kind of an idea of other contracts that we work on, one of our larger contracts is the National Center on Substance Abuse and Child Welfare. Through that contract, we operate the In-Depth Technical Assistance Program. We operate the Children Affected by Methamphetamine, which is also a family drug court program that is funded by SAMHSA. Those 12 grantees that were funded back in 2010. So they're going to their last year, and we provide the technical assistance and the performance measurement for that grant program. We also provide technical assistance for the regional partnership grants, both the first round and the second round. And then in addition to OJJDP Technical Assistance and Training Program, we also are launching our Prevention and Family Recovery Program, which is foundation funded through the Doris Duke Charitable Foundation and the Duke Endowment, which is funding for family drug courts to enhance systems improvements around parent training and children's services. Another resource that we would like to make all of you aware of as you're maybe just starting out, or you have new staff coming on board, or you like to make sure that your partners from cross agencies are familiar with each other's roles. We like to point to the National Center on Substance Abuse and Child Welfare's online resources. You can access those here. These are all free resources to you. There's videos, but the main thing I'd like to highlight to you are the online tutorials. There's a training for child welfare workers understanding substance abuse treatment and recovery. There's also an online tutorial for recovery specialists understanding the dependency court, the child welfare system, and then there's a tutorial specifically aimed at attorneys or judicial personnel understanding treatment and the child welfare system. So those are available to you. And so now we'd like to try a polling question. So we're going to go ahead and launch this question. We just wanted to ask, and I know some of you are very familiar, but how many of you are familiar with the National Center on Substance Abuse and Child Welfare and their resources and products? So we'll go ahead and launch that polling question now, and we'll give you a few minutes to respond to it. We'd like to hear if you're very familiar, somewhat familiar, or not too familiar. Okay, so I don't know if all of you can see it, but I'll go ahead and read those to you. So about 50% are somewhat familiar, a quarter of you are very familiar, and then about another quarter are not familiar. So anyhow, that website's there available to you. Lots of free products, downloadable products, and online tutorials available for you there at the website. So let's go through and talk about OJJDP's Family Drug Court Training and Technical Assistance Program. Again, we are contracted with OJJDP, happy to be supportive of Mark and Angela in their efforts to improve outcomes for children and families by providing training and technical assistance that develops, maintains, and enhances family drug courts across the nation. The goals are to, first of all, assess and address the national TA needs of family drug courts. We'll be working to develop and implement enhanced TA training materials and activities. We're hoping to build the capacity of your family drug courts and enhance the knowledge and skills of you and the professionals you work with. So I'll give you an idea of some of the things that some of the products that we work on. And we'll talk through some of these in more detail, but we work on collaborative practice and policy tools, information and sharing models, expert consultations and research, monographs, white papers, fact sheets, training resources, and then also long-term strategic planning and development of protocols and practice models. This is specifically important, this long-term strategic planning, when looking or interested in a site visit. Oftentimes, if you are interested in a site visit, and we'll talk more about this later, but typically we do engage with you in some pre-site work, some assessment of your site, and then follow-up action planning and strategic planning. So we'll talk more about that later on today. And here's specifically what we're going to go through real quickly. So we're going to talk about the Family Drug Court Guidelines, which were supported and published in May of 2013, supported by OJJDP. We're going to talk about the Family Drug Court Learning Academy, which is an online webinar series. We're going to talk to you about our peer learning court program and some expansion opportunities available there, our technical assistance liaison, on-site visits, our virtual meeting facilitation, and your ability to access expert consultation. So to start with, I wanted to just give you a quick overview of this document. Hopefully many of you have seen this already. This is titled Guidance to States Recommendations for Developing Family Drug Court Guidelines. It provides a set of recommendations, 10 recommendations, and actually includes over 100 specific strategies to enhance or implement your family drug court. This was developed with support from OJJDP in partnership with other federal and state stakeholders. It's based on research, previous publications, practice-based evidence, and expert advisors and existing state standards. It can be used as a resource tool both for states in developing their own standards and or for monitoring local family drug courts. It also can be used for local courts in both improving your practices and enhancing your practices or developing new courts. As I said before, it contains 10 recommendations, or what we call the Family Drug Court Guidelines Framework, and a description of each of those. It also includes what the research is that supports those recommendations, and then what the effective strategies are surrounded by each of those recommendations. If you're not familiar with this document, you can download it, or you can watch a webinar that we did on it just last year, which we'll talk about how to access those in just a moment. But basically, the Family Drug Court recommendations are built on a foundation of developing shared mission and vision. We then believe you need this pillar of agency collaboration, which includes building your interagency partnerships, sharing information, cross-system knowledge, and of course funding and sustainability beyond the grant. And at the same time you're working on those agency issues, you need to be working on client services. So being able to early on identify those parents and providing clinical assessments of those parents and families. Addressing the needs of the parents, addressing the needs of the children, and also garnering the community support for these families once they leave your programs, all working towards shared outcomes. So again, these are the 10 recommendations and the framework for the Family Drug Court Guidelines. We'd be happy to send you a copy of this if you're interested. The next thing I'd like to speak about real briefly with you is our Family Drug Court Learning Academy. So far we've had 29 webinars, 55 hours of content, which included 49 expert presenters, had over 2,000 attendees from 45 states, and about a 4.3 satisfaction rating on each of those. So far we've had 4 learning communities. The first one started with the basics of the planning community, and then we moved on to early implementation, and then enhanced, and then we've had an advanced practice community. That all of these webinars now are on our website in our archive library that you can download and listen to and play back. And this was our 2013 list of webinars, and as I said, in September we recorded the Raising the Bar on FDCs to look at the Family Drug Court Guidelines. So if you're interested more on that particular webinar, you can go to our website, download it. We do hope that you'll join us for this year's Learning Academy. This changes everything. And for more information on this, please visit our website. And there's the website for not only upcoming webinars, but all the past webinars as well. What we also have done to make the learning more interactive is that we launched back, I think, in 2010, our Family Drug Court Learning Academy blog. So this blog coincides with each presentation. It includes webinar updates, presenter information, past presentations that presenter may have done. It includes past publications that the presenter may have published, other resources on the topic, and then post follow-up questions and discussion forums. So we do encourage you to visit our blog. It's at familydrugcourts.blogspot.com. So it's another way that we try to make this learning as interactive as possible with you, and also another way for you to interact with your peers through that discussion forum on the blog. With that, I'd like to turn it over to our Family Drug Court Technical Assistance Training Coordinator, Alexis Balke.
Hi, and thank you all for joining us today, and thank you, Bill, for going through some of the products. And I want to take a second just to see, since we went through some of the programs and products, if anyone has any questions up until this time. Just a reminder that you are not muted, so you can go ahead and tell us if you have a question, or if you'd rather type it into the chat box. If you're more comfortable with that, then you can go ahead and do that as well. Okay, great. That means you did a great job explaining all the products and programs that we have. So here's another program that we wanted to just let you guys know that we really do think that peer learning is just it benefits in so many ways, whether you're implementing or enhancing your family drug court. Having another peer course to kind of talk through some of those processes or barriers that you might be experiencing. So through an intensive application process, we did identify 4 peer learning courts that are serving as the model courts for FDCs. These courts all use evidence-supported practices and policies. They have demonstrated strong collaborative systems or strong collaborative teams across the courts, child welfare, and substance abuse systems. And the great thing is that they're available to share with you any program policies and procedures, any type of logic models, and then they can also join us on conference calls and share some of their lessons learned. And they also host visitors. So if you're interested in visiting one of the courts, or whether you are implementing a new court and you'd like to see one in action, or whether you are hoping to enhance or expand your target population and want to see how another court might be doing that, they love to host visitors. If you're interested in doing something like that, either connecting over the phone or getting some more information, or even going out to visit them, you can email peerlearningcourse@cffutures.org, or you can contact me, Alexis, who is also the coordinator of the Peer Learning Court program. And lastly, and I'll show you in a second a little bit more about our website, but there is a web page for the Peer Learning Course on our website that you can request information through that method as well. So here is the Family Drug Court's homepage for our website, and I want to just briefly go through some of the key pieces of this to help you navigate if you are interested in getting some training and technical assistance for your Family Drug Court. So first off, you will find here on this tab up, you have resources, and this is a list of all publications, child policy reforms, collaborative practice tools, and other related links that will help you in enhancing or implementing your Family Drug Court. There also is a drop-down specifically for Family Drug Court materials in this resources piece as well. Right here you will see presentations. This is how you can access and find links for every presentation that we've ever facilitated at local, state, federal level, or federal level conferences, and all of our webinars. Not necessarily all Family Drug Court specific. They can help in many different ways, but there are also Family Drug Court specific webinars and presentations listed out there as well. Next, National Center of Substance Abuse and Child Welfare. Phil mentioned some of their training and technical assistance opportunities and materials that you can find on that website. So this link right here will direct you straight to their website if you're interested in learning more about the tutorials or any of those resources. The Learning Academy, that's another program that Phil spoke about a little bit earlier. This gives you access to previous webinar materials, also shows you about information about upcoming webinars, and a little bit more about the program in depth. The Peer Learning Core program, that's the one that I just spoke about briefly. This is where you can read about each of the Peer Learning Core programs. You can look at their profiles. You can see some of the information that they've already shared with other courts, and then you can also submit information or submit your request if you're interested in visiting or receiving any kind of technical assistance from the Peer Learning Core program. Down here is the Family Drug Court blog. This link is going to direct you right to that blog that Phil mentioned that was built kind of in collaboration with the Family Drug Court Learning Academy to help just enhance the learning opportunity through peer-to-peer comments and feedback and postings. And then lastly, if you'd like to contact us for any reason, if you have any questions or have any technical assistance requests, you can go ahead and select this link, and it will go ahead and it will direct you right to our email to contact us. So next I want to tell you a little bit about the opportunity and the access that you have to a technical assistance liaison. Basically this is someone that's going to, if you have any kind of technical assistance request, this is the person that you'll be speaking to. And that person right now is me. So you'll be either contacting me or I'll be giving you a call or sending you an email to clarify what your technical assistance request is. I also, I'm on the Family Drug Court team, so I often communicate and can be that liaison with Mark and Angela as well. And I maintain communication among all the grantees, so I can set up any kind of peer-to-peer network, any kind of peer-to-peer calls or sharing program policies and procedures or anything along those lines. I also assist with any type of site visit request that you may have, whether that's doing an assessment to see what you're really looking for and what your goals are, helping you develop that Family Drug Court survey that Phil has discussed during his portion briefly, and then help facilitate any type of virtual or in-person meetings. I think I actually spoke to some of you already as you just received this grant and asking for some technical assistance already, and I think I even have a call on Friday with one of you, so that's great news that we already are accessing our technical assistance. Just to give you a little bit of background, we do have 4 levels of technical assistance that we offer, all the way from level 1, which is just information sharing, just sending quick resources, things along those lines. Level 2 is when we actually get on the phone, do an assessment of what your TA needs are, maybe bring in a consultant or do a little bit more research and, to help meet your technical assistance needs. Level 3 is usually staged specifically for those that are interested in having a site visit or any kind of virtual event. And level 4, which is you guys, are our ongoing technical assistance relationships because you are OJJDP grantees, and we can offer more strategic planning and some longer-term technical assistance. So I already kind of spoke about some of the ways that you can access RTA, but there's the needs that you may have, reviewing relevant documentation. If you want to develop a scope of work, things along those lines, and then we provide a TA, so those can be anywhere from on-site visits, helping you with some problem solving, development of resource and materials. And then we always, typically at the end of our TA, we want to develop a concrete action plan, which just has next steps and some benchmarks and timelines. And then we always follow up with you to make sure that you are reaching those benchmarks. And if you've experienced any more barriers in implementation of the action plan, things along those lines. So our TA is along a continuum. It's not just a one-stop shop. We engage in a relationship with you, and we make sure we follow up and help you really implement some of those action items or objectives that you create in action plans. So the Family Drug Court Survey, Phil had mentioned briefly, is built from the Family Drug Court Guidelines. And the survey it's anonymous, it's online, and it's built in. It's something that we have distributed to all the Family Drug Court team members, to stakeholders, to anyone that would, and policymakers, that anyone would have any insight to how the Family Drug Court is currently kind of, what the practices are, whether or not they want to assess some of those practices. The things that it really highlights is really gaining that insight on perception of who the target population is, what the current scale is, and where it potentially could be. It has an inventory of some Family Drug Court best practices. So what that means is that we ask, what your perception is on how successful your Family Drug Court is implementing some of these best practices that we recommend in the guidelines. Identify some strengths and challenges, and then as a result, we take those, or at the conclusion, we take those results and we analyze them, and then we build them into a presentation, or we help you identified some areas of needed improvement to start building an action plan. If you're interested in doing a family drug court survey or doing any type of assessment of your current practices, then that would be a great thing to go ahead and contact us for. And then we also, we have many resources, and CHCFF has an evaluation team that can assist with any commonly seen evaluator TTA requests. What data should you be collecting? How can we effectively share our data across systems? What instruments should we be using? What's really going to show our success as a family drug court? How are we going to maybe look at some cost benefit or cost of the program, cost neutrality, things along those lines. So if you're interested in getting any kind of evaluation technical assistance, again, that would be a great thing to contact us for. And then as Mark mentioned earlier, if you have questions or needs specifically to uploading your data to the DCTAT system, you can go ahead and access the DCTAT help desk, or if you are more comfortable with just contacting us, we can help try to be that liaison for you. Lastly, we do have a large consultant pool that can assist with any TTA requests. If our family drug court team is unable or we don't have the resource in our back pocket, we do have a team of experts that we can access and make sure that you're getting the most comprehensive response to your request as possible. Our consultants can participate in phone calls, they can go on site and help facilitate some trainings, or help us, or guide us, or give us some resources to help respond to your TA request. So I think at this point we're going to go ahead and do another polling question. So we would like to know, after hearing about these resources and training opportunities, would your site be interested in receiving technical assistance?
Alexis, I have a question.
Sure.
The question is there a charge for any level of your technical assistance?
So the ones and twos, so basically the sharing of resources, the phone consultation, things along those lines, no, absolutely there's no charge to you. Now we do, and I know Phil might be able to speak to this as well, but we do talk about some cost sharing opportunities if we're going to go on site or do some other types of training opportunities.
Yeah, so this is Phil. So I wouldn't say there's ever a charge. There may be, because we're limited in the number of on-sites that we can do, we may, if there's a site that you're really interested in, we may not be able to, we might not have capacity for on-site during the period that you're interested in. Sometimes there's opportunities to cost share travel costs, and many times we can expand our capacity that way, but there's never really a charge.
Thank you.
Okay, I hope that's helpful. Any other questions before we launch the polling question? Oh, actually, the polling question is launched. Okay, let's go ahead and close that polling question.
Okay, great. So it looks like the majority of you are interested, may not know for sure if they want to move forward with technical assistance, but may be interested in learning a little bit more about the program. So if you do have any questions, if you want to learn a little bit more about what services we offer or how to access them, please feel free to contact me anytime. My information will be on the contact slide at the end of this webinar, and then you'll have also with the materials that you received today is a flyer that kind of gives a little bit more information about some of the programs and opportunities that we offer through our program, through our technical assistance program. And here you'll see a snapshot of the technical assistance that we provided so far. So you can see that we, this gives you kind of an understanding of the sheer volume of TA that we've responded to, and some of the most common requests that we see is that engagement and retention piece, and how do we respond to our parents' behavior effectively, and what do those therapeutic responses look like, implementing some training plans and curricula, maybe some help with identifying screening tools or how to implement these screening tools and assessments in our family drug court, and of course sustainability planning and things along those lines. So you can see here that there's a wide variety of technical assistance requests that we can help you with. And we've worked with over 300 family drug courts across the country. So the benefit of that is that we're able to share some common and effective practices that we're seeing across the country that are happening right now in jurisdictions that may be similar to yours. So any barriers that you have experienced or are experiencing most likely have been experienced in other jurisdictions, and we can link you with some of those family drug courts as well to see how they overcame some of those. Okay, so now we want to go ahead and open up, and the lines are already open, or of course if you feel more comfortable to submit it in your chat box, we can respond to those as well. Any questions or comments or anything you'd like to share at this point?
We have a data system in mind. It's called DCCM, and we would be interested in knowing what data systems are recommended to new family treatment courts that do not have existing data systems.
Sure, this is Phil. So we'd be happy to consult with you on that. There are numerous, there's private enterprises that do offer drug court data systems. We also provide technical assistance for sites if you don't have the resources to purchase like an off-the-shelf type of drug court data system. There are also ways, in fact, American University has I think a free data system. I think it's an access that we could share with you. There's also ways to track outcomes via some of your existing administrative data through building linkages in your child welfare system, in your substance abuse treatment systems, and in your court systems. Oftentimes, a lot of the data that you'll need to track is being collected by at least one of those agencies. And so finding some way to build linkages so that you're not duplicating data entry is oftentimes sometimes a little bit more work up front, but it's also much more sustainable, and it's built into some of the shared outcomes and joint responsibility recommendations that we often make for sites. A great resource to start on that would be what's called our data primer, and we can send that out as a potential link as a follow-up to this, both to you directly and to the listeners as something to take a look at on where certain data elements are already collected in administrative data. But again, if that's but looking at specific, again, off-the-shelf type of data systems, we'd be happy to consult with you on that. And if it's something that you're building, we'd also be happy to share with you some of what we feel as really important performance measures or data indicators that should be in that data system.
Thank you.
Yeah. One point to make on that, and this is a little bit of a soapbox, but one of the real important factors, especially if you're new or you're in a state with a statewide drug court data system, what we're seeing and hearing from state to state now in many states is that family drug court graduation rates typically don't look as good as adult drug court graduation rates. And I would just want to make you maybe aware of that or caution you against being compared to adult drug courts. And the main reason for that is maybe obvious to some of you is the Adoption Safe Families Act, ASFA. That requires that that children, that there's only a certain amount of time, that limits the time frame in which you can work with these children and parents and families. Once the child's removed, you have to make, the parent has to be making progress towards reunification within 6 months. For children under 3, it can extend up to 12 months, or for children over 3, they must be making progress towards reunification within 12 months and extend up to 18 months of services. When you put that into days, we're talking about 300 to 400 days if the parent, from the time the child was removed, is right into treatment. When you look at graduation time frames in adult drug court, so again, have sometimes better graduation rates. Graduations often are sometimes at 3, 4, 5, 600, 700 days before a parent or a participant will graduate from that adult drug court. You're not going to see that in family drug courts because the restrictions that ASFA places on the child welfare dependency court systems. So pure graduation rates versus looking at outcomes such as reunification, keeping kids at home, reduced recurrence of maltreatment, reduced reentry rates, timeliness access to treatment for parents, treatment retention, keeping parents in treatment 90 to 120 days, has great long-term reductions in recurrence of maltreatment, and it also greatly improved the likelihood that child will be reunified with at least one parent. So those types of indicators are, in our opinion, more productive and more helpful for you in the long term of sustaining your programs. So again, a little bit of a long-winded answer, but real important when you're looking at statewide drug court data systems.
Great. Thank you, Phil. And if you have any additional questions or follow-up needs based on what Phil mentioned, please contact us, and we'll go ahead and send out that data primer link. Another question that we received is, are there plans for face-to-face grantee meetings for this project in 2014? We are, in a couple minutes, after we get through the questions, we do have a slide talking about having a OJJDP Grantee gathering at NADCP this year. That's going to be located in Anaheim. We will send more information as it gets a little bit closer about what that will look like, but our plans are to have a gathering at NADCP. So if you are planning on attending, or we highly recommend that you plan on attending the NADCP conference, then we would love to see you there, and we'll go ahead and host that gathering. We do have a couple more questions, and then do you want to go over this again, or do you want to go further? Okay, and then another question we received is the Family Drug Court Survey something that is required or an optional tool that staff can use? And it is definitely an optional tool that staff can use. It is not required unless you are interested in doing more long-term or an on-site visit. We would want to do the Family Drug Court Survey just to get a better understanding of some of the practices in your jurisdiction, but it definitely is not a requirement of your grant. Are there any other questions? Okay, and if you think of anything later, you feel free to contact us anytime with any questions that you may have.
Okay, so let's wrap up and just talk about some next steps and a little bit of closing remarks. Just to point out what's kind of on the horizon for us here at the Training Center. We have conducted a comprehensive needs assessment of Family Drug Court training and technical assistance needs. That has been submitted to OJJDP and will be hopefully being published on our website and distributed by the end of January, beginning of February. And there's some great insights on that. That will help us kind of, and it has helped us prioritize our Learning Academy for both 2014 and 2015, as well as some of the materials that need to be developed as we move forward. We will be conducting 6 site visits this year, with potentially another 6 next year. And again, if there's cost-sharing options with some sites, then we can expand those. We will be adding additional peer learning course sites. So if you are really an enhancement court, you've been a long-term, strong court, and you're interested in being nationally recognized, the mentor court, and being highlighted at the national conference of Mentor Court Row, contact us and we'll let you know what that looks like. At this point, we're planning to launch the application in September of this year. As I stated earlier, we'll have a new Learning Academy series, 6 webinars this year and 6 next year. We're also beginning to develop a Family Drug Court online tutorial, which is self-paced learning, so that if you have new staff that come on board and you'd like for them to take a tutorial to really be orientated to Family Drug Court, so be able to take an online tutorial. We plan to enhance the Family Drug Court guidelines in 2 ways. One, just adding updated research and updated strategies. And then secondly is this make the facility tool that we're calling the Family Drug Court Assessment, make that available online so that folks can actually download it and take those, take that survey themselves and use the results themselves. Also, we'll be presenting at national and regional conferences. We'll be presenting at the National Child Abuse and Neglect Conference in April in New Orleans, which we'll be doing at Family Drug Court Policy Institute. And then we're also hosting what we're calling the Family Drug Court Symposium at the National Association of Drug Court Professionals Conference in May in Anaheim, California. That will be a two policy institutes on the day day before the conference, and then a full Family Drug Court track throughout the conference. We also are see you there at the grantee gathering, and we're hoping to have Mark and Angela out here also so that you can meet with them in person, and they might be able to answer any grant questions that you might have as you get into about halfway through your first year of implementation. And that is it from us. Here is all of our contact information. Feel free to email us or call us. We'd really like to help in any way we can for you to be successful, not only with your grant, but with your programs and with the children and families that you serve. So, Mark or Angela, do you have any other closing comments?
I don't have technical difficulties again, but I don't have anything else but congratulations. Thank you for your time, and we really look forward to working with you in this upcoming year. If you have any questions, email or call either one of us. Angela?
Same for me. Thank you again, and congratulations on receiving your award, and we look forward to speaking with you.
Excellent. Okay. Well, thanks to Mark and Angela. Thanks for OJJDP and their support. And again, congratulations to all of you grantees, and good luck on your efforts. Please take a moment to complete the evaluation of this webinar. We would like to hear your feedback so that we can make it, we can improve upon it for next year. All right. Thanks to everyone, and we look forward to working with you all. That will conclude today's webinar.
Thank you so much.
Okay, bye.